I'm Carolyn Sheridan, Executive Director and founder of Ag Health and Safety Alliance, and I'm doing a presentation on personal protective equipment, more specifically respirators. Now, a majority of this presentation was put together by Chandran, and I did a little modifications or editing and adding some personal information about the types of respirators that I've been working with for the majority of my career as a registered nurse in a rural setting, but also in delivering ag health and safety programs to students from many countries and from around the world who also need respiratory protection. So here's our learning objectives, and I know that you have these in the syllabus, so I'm not going to read them to you. And I know that a lot of this information is very important as we talk about respirators. And we'll just use some brief terminology here related to respirators. The first being on the left-hand side, which is surgical masks, dust masks, face masks. And the face mask would, of course, be what we are, a lot of us are accustomed to now because of the pandemic, and something that many of us wore for quite some time. And so for respirators, I want to make the distinction that these are masks. They're not respirators, and so I have switched my terminology. I know not everybody has, because in the general public, they think that about a mask for respiratory protection. In this case, we're going to talk about them differently, though. A mask does not provide good protection for respiratory exposures in occupations. In the middle column, we're talking about filtering face pieces, which would be non-powered, which would provide protection, and filtering air piece respirators, non-powered, which would be cartridge respirators. Sometimes they're called elastomeric respirators. And the last column would be powered air purifying respirators and self-contained respirators or self-contained breathing apparatuses, SCBAs. So 3 different types of one's masks, and then the others are respirators. Also do some clarification, important terminology, important information about NIOSH certified respirators. And this is something we've spent a lot of time talking about, more so I think during the pandemic, because it got confusing. We were being told to wear surgical masks or cloth face coverings to protect ourselves during COVID, or protect others, as you might say, but they are not NIOSH certified. This very specific process or research that's been done to make sure what we are stating a respirator can protect us from is actually the case. There's a very good diagram here. There's also a website, the cdc.gov/NIOSH, that gives really some very distinct or very good descriptions and information about respirators. So on NIOSH certified respirators, there's a lot of information. I think if you take a really good look at them, it's got a TC number, it's got a filter class, whether it's N, P, or R. So next time you look at one of these 2-strap respirators, take a good look at it and see what is there. Types of respirators: non-powered and powered respirators, and we're going to talk about those specifically. So non-powered respirators are the ones that do not have an air source. So basically, you're breathing in the air, and your respirator is filtering the hazard for you. The examples on the left are N95s, one with a valve, one without a valve. These can be tight-fitting respirators. They have an air filtering. They're negative pressure. And these can be used to prevent aerosol exposure, but not used for gases and vapors. And then on the right-hand side are the half-face elastomeric and full-face, also reusable, tight-fitting, air purifying, negative pressure, and used to prevent the types of exposures that we might have for gases and vapors. So what is this difference between negative pressure versus positive pressure? A respirator in which is negative pressure, in which the air pressure inside the face piece is negative, lower than during inhalation with respect to the ambient air pressure outside the respirator. Where positive pressure respirator is a respirator that uses a power source that blows filtering air into the face piece. So there's a very important difference here. Also in disposable respirators, which are typically what we call the two-strap disposable, NIOSH does classify the filtering media in its respirators based on the resistance to oil and the particulate filtering efficiency. And the resistance to oil is designated as an N, which is not resistant, or an R, which is somewhat resistant to oil, and a P, which is resistant to oil. And also, it's either 95% efficient, 99% efficient, or 99.97% efficient. So these are all very important as we make some choices about understanding what would provide the best protection based on the contaminant or the hazard. So as far as oils, some of the products containing oil would be fuels, lubricants, hydraulic oils, solvents, paints, and some pesticides are sprayed used in a process producing aerosols and droplets, and the oil component may become airborne. So we want to make sure that we're protecting our individuals from those as well. And in the reusable respirators, we also have an option to add cartridges. And that's what I really like to talk about when I'm telling people how to move from a disposable two-strap respirator to something where you get more protection by adding a cartridge. So this is a very good list of cartridges, and they're color-coded. The thing that's interesting is that these color codings do change from country to country. So what we're looking at here is the colors for in the U.S. For example, a green is related to ammonia gas, and then a olive, my favorite, or the would be multi-gas. And I like those because many times the people that I'm working with certainly are exposed to something on days where they would need more than one type of protection. When I talk about the work I do, I mean in agriculture. And so what we have done is to develop resources that are very specific to this occupation, because we know all occupations are different. And in this case, we've developed a nice little color chart that's just really for the specific exposures in agriculture, so it reduces the confusion. And as you can see, the P100s and the organic vapor, the ammonia, multi-gas are very appropriate in agriculture, so that's why we kind of narrow down the color chart for this occupation. As far as powered respirators, we can talk about powered air purifying, or PAPRs, or we can talk about escape emergency breathing, which is EBA, or self-contained breathing apparatuses, which is SCBA. The difference being the powered air purifying is there's not an oxygen source. We're simply using a powered air to move the air up and around our respiratory system up and providing us that type of air movement. Where the escape emergency and the SCBA does have an air source or an oxygen source, which would be for situations would be considered immediately dangerous to life and health, which is an important distinction in many, many occupations or rescue type of situations. Also, assigned protection factor is important. I have two charts up here. The first chart is a very basic, talking about the different types of respirators. For example, air purifying half-face piece, the assigned protection factor is 10, all the way up to SCBAs, which of course are much higher protection factor. So I like the chart at the bottom. It's the one we use for many people who are trying to understand assigned protection factor, because it gives a nice scale in an arrow with numbers that say 0, which would be like the nuisance masks that we talked about towards the beginning of the presentation, all the way up to powered air purifying and SCBAs. So I think discussions about respirators should include information about what is that protection factor and how will that help me make sure I'm protecting myself against the hazard. So also when we talk about respirators, we need to talk about the fit. So you need to find the right respirator with the right fit for the job. And to get a good fit, we really do encourage respirator fit testing to ensure the respirator forms that good seal on the face And there's two types of fit test. One is qualitative and one is quantitative. The qualitative is a pass-fail method. It's very subjective. We rely on someone to tell us if, in fact, they can taste or taste that irritant in order so we can know that we're detecting leakage into the respirator fit face piece. But it doesn't measure exact amounts of leakage. So whether the respirator passes or fails is really based simply on the individual detecting that leakage of the substance. So listed here are the 4 different methods which are accepted by OSHA. I would say that saccharin tends to be the most common, which leaves kind of a sweet taste in the mouth. Bitrix seems to be the one that people default to next, which leaves a bitter taste and that people grimace, so you tend to know more than if someone is, if we're using saccharin. Situations where I've switched to Bitrix would be a situation where I was uncertain if the person was actually telling me if they did or did not taste the saccharin. Bitrix, it felt like it was more of an involuntary response a little bit. So these are the different types of OSHA, different substances that OSHA does accept. Quantitative fit testing, on the other hand, does measure the actual amount. We get a numeric assessment of the respirator fit test, and it does not rely on the individual to taste, smell, or smell the irritant to detect leakage. Now, these are a little bit more expensive option. They can hook up to computers, and they range in price. So sometimes companies or feel like they're too expensive, so they move back into the qualitative fit test. Now, the fit test procedure is very clearly laid out in the OSHA standard. You have to follow these procedures to make sure we're doing it correctly, to make sure we know if this respirator does indeed fit somebody as it's designed. And so we make sure that we follow those very specific procedures. This is the procedure outlined in sentence format, 1 through 4. It doesn't talk about the entire procedure, which is laid out very specifically in the fit test instructions and also in OSHA. I find this kind of direction a little bit harder to read because I have to think about all the steps. And I actually like this next slide. This is from 3M. I have seen it elsewhere too, but it really lays out very well the sensitivity test, the fit test, and all of the different exercises, the 7 exercises that need to be performed. And so when you're doing fit testing, it's better clues for me. I've done a lot of fit testing in my career, and I felt like this kept me on task better than trying to continue to read step by step. Even though I've done a lot of them, it can be easy to forget one of the steps, which is really important to doing a fit test according to the OSHA standard. And there are some other considerations. So if you're going to be doing fit testing or understanding fit testing, we know that there's medical clearance, which can be specific for a particular make and model. Workers should not have facial hair, which interferes with the respirator seal. So based on the occupation and the individuals that are supposed to have a fit test, this can be tough for people. They don't necessarily want to shave. So that's a whole other part of fit testing and about making sure that we have a good respiratory program where people are doing their part to make sure the respirator always fits. We also know that there's certain cases where you might have to redo a fit test if someone's had lost or gained weight. They maybe have ended up having dentures. They have scars on their face after surgery or an accident. And also the standard states that they must be done annually, or if, as the things I just mentioned. Here's a great infograph, as you might say, that I like to use for people with beards, because there are some acceptable facial hairs, not very much, but this kind of gives people an idea of maybe an option they could have if they want to keep some facial hair. So CDC put this together, and I really like it as well. So the right respirator with the right fit, that means that every time someone wears a respirator after they've been fit tested, they must do a user seal check a positive pressure and negative pressure check. And this is, like I said, performed each time the individual wears the respirator because the straps can change, things wear out. We want to make sure that the respiratory protection works every time. I did provide two good resources that are clickable for you. One comes from our Save Your Breath resource, which I talked about in week 14. And then also the user seal check, which comes from CDC. Also have a third one, and I'm not going to play this video because you can certainly click to that, and it's in the resources. But this is a great resource so that you can see on a short video exactly what user seal check is versus respirator fit test. So respirator maintenance and storage is also important. And as you can see, we have a 8511 here that looks like it's ready to be thrown away. It looks pretty dirty. And we're also showing right here the reusable respirator that we do need to take those apart and clean them. And some people say periodically, and I would say that in industry or in occupations where you have a respiratory program, you are stating when these respirators need to be cleaned. It could be for every use, maybe it's every 2 days. That is established in the respiratory program. So stored correctly is very important. Now there's a good little motion graphic that our Ag Health and Safety Alliance put together. Even though it's designed for agriculture, all the pieces of it fit no matter what occupation. So this is also clickable and in your resources. So it's a great short little video. I believe it is about 2.5 minutes. So if you're doing fit testing and teaching people how to take care of the respirators and store them, that's a good little video that you could use. So in this short little presentation, we talked about different types of respirators. We talked about NIOSH, talked about the N, the R, or the P labels and what those mean. So take a good look at the resources that we outlined in this particular presentation, as well as in your syllabus or the information that you're getting about this course. So this is information about respirators. Here's my contact information, and then Mr. Ayantan, who's leading this course, some good contact information for him if you have any questions. It's been great talking to you today.